I was getting orthotics at the hospital, and a young man was in the next room who was 17 who was being refused a new pair of shoes because his feet were growing. And I heard the guy say to him, "Your insurance doesn't cover shoes, a new pair, for 6 months." I thought, this can't be. Here's a 17-year-old boy that's in pain, and we can't help him. I formed a fund, and it's a fund for children who need something who are not insured, and they need it right away.
Ms. Wright has made it very clear, that a child should not go without shoes. The same thing with braces and artificial limbs. I mean, if somebody needs something, we're going to find a way to do it.
Growing children require adjustments to their prosthetics and orthotics, and typically they're seen every 6 months while they're growing. Adjustments are made at least twice a year, and new prosthetics may be needed every 2 to 3 years, so it's a fairly expensive proposition.
That's actually where the Wright Fund has really come in. Some insurance companies, particularly private insurance companies, will only pay for a limb every 3 to 5 years, and that's really the value to us. It really helps us meet the needs or fill in the gaps where someone's insurance doesn't.
You just sit back in the pocket and be the quarterback, just throw it, right? Just wing it. Take off, I'm going to wing it. You get there and catch it.
You build long-term relationships, and Robert is one of them.
When he was 8 months old, he had to have both of his legs amputated because he only had one bone going from his knee to his ankle.
Hello, Robert.
Hello, Robert.
How you doing?
I'm good, and you?
John, will do anything for him. Whatever Robert wants, John will do it. As rough and tough as John sounds, whatever Robert wants, Robert gets.
This is going to be the sealing part that locks you in.
And that's because of the relationship he's developed with Robert over the years. He treats him like he would his own son. And that's important. I think that's part of what our hospital is all about.
That's why I'm comfortable here. That's why my old insurance told me I would have to go somewhere else. I wanted to switch my insurances so I could keep coming here and come comfortable here.
How much is a pair of legs like this?
This leg right here would probably be around a $30,000 leg.
Just one?
Just one.
It's the first time we're doing the new seal because they're going to be suction sockets where you're using an expulsion valve and whatnot.
I really like those, but he told me I'll be able to do them.
Ready?
And the process of how I'm able to put them on without the strap, and I'll just be able to put my leg in and push the air out so it'll be tight.
Hear the air coming out?
Yeah, I do.
That's what he's doing. He's pushing down, getting the air all out. You good?
Yeah, I'm good.
Good.
Are you taking him home with him today, or?
I want him to. I want him to play.
The type of components we're going to use are very high-end components for him because he does a lot of sports with it. He likes to play basketball. He wants to play football. I don't know how that's going to work, but we'll see on that.
I run around with my friends, go to the movies, I go outside, everywhere. I just do basically anything I want to do.
And as far as the fund goes, yes, we're thrilled to give him help and watch him grow. He's now in school, he's working, he has a baby, he's just doing fantastically. After 2 years, I see a big difference.
He's Robert, and he enjoys life. You could tell when you talk to him and which way he does, he sort of has a glow about him. He's very comfortable with himself.
I just want everyone to know, because you have a disability, don't let it hold you back. Just keep doing what you want to do and put your mind to it. And you can do whatever you believe in.
It's an inspiration. How can you have a bad day when you see what he goes through? It really is a testament. Additionally, in this past year, we've had an opportunity to take care of some Haitian patients that were caught up in the earthquake. The Wright Fund has really given us an option to take care of and expand our horizons. Now we're really looking to go beyond our borders to extend our reach of health care to those who need it.
I never would have thought that an earthquake in Haiti would somehow come back to our little fund.
We basically performed Civil War medicine down there. We were saving lives.
And in some, because it had been 4 or 5 days before we could get to taking care of their open injuries, the only choice was really an amputation.
Lift and turn it over.
Darline is a 25-year-old.
And we'll stack them like that.
She worked as a bartender at the most famous hotel down there, the Hotel Montana. She was working, actually, when the earthquake happened. She spent 5 days buried in the rubble until they could actually free her, and she lost both her arms.
One of them is gone at the wrist. It's a fairly simple prosthesis. It's around $5,000, $5,000 or $6,000. The other one is amputated above the elbow, a little more complicated. You're looking at around $10,000 or $12,000 for the arm there.
Children who come from outside the country generally don't have any coverage at all. And so children who come from outside the country benefit from the Wright Fund more directly because everything is covered by the fund in that case.
Her world was turned upside down. She came here, she was afraid, scared, a new country, very dependent on her mother and family for everything.
Her mom would take her to the bathroom, dress her in the morning, feed her, brush her teeth, do her hair, and slowly, over time, we broke down each task into small bits, focused on those that were most important for her independence, like using the bathroom, getting dressed. And over time, she's become more and more independent, and then that led us to more complex tasks, such as food prep or taking items out of her wallet. The last few months, we've been working on getting her ready to go off to college.
I want to be a psychologist, and I think it's my biggest goal now.
Independently now, she's setting her sights on, I want to go to college, I want to get a degree, I want to get a skill, I want to be self-sufficient. And that's a huge attitudinal change than what happened when she came here. And Aviva has done an outstanding job working with her. I am just so impressed with the work that the two of them have done together. It's a success story, but a lot of it was Darline. She's the one who did the work.
So yes, she got arms from us, but her spirit and her heart inside and her mind and her hopefulness are going to take her further.
Unfortunately, there are many people in her situation who did not have the fortune to come here, and they are back there. Clearly, they don't, there aren't the resources for prostheses.
The biggest thing that future donations to the Wright Fund will allow us to do is to expand our international outreach. And it's something that we have experience with, it's something that we've done, and it's something that the hospital has been very supportive of.
The Joe and Ellen Wright Fund for Prosthetics and Orthotics is going to grow. It has to.
Je sais pas comment je peux la remercier.
I don't know how to thank her. I don't know how, but the only thing I can say, it is a big thanks to Helen, a big thanks.
I'm standing on the site of the new Children's Pavilion, which is a project that the hospital undertook, I guess it was 4 or 5 years ago, and it's now coming to fruition.
In the new form that it's going to take allows us to provide care to the whole range of pediatric orthopedic problems.
There's so much growth going on here, and it's not by accident. It's because we work hard to do the right thing, and I think it shows in the work we do.
When somebody's taking their first steps, like Robert in his new legs, or you see Darline picking up a penny with her prosthetics and taking a dollar bill at a time out of her wallet, there's no describing how rewarding it is and how wonderful it makes you feel to contribute in some way.
At the end of the day, a lot of people are better off because of the work we do here. At the end of the day, we'll make the world a better place.
I think now I'm good. I'm good for now.